Good afternoon, or good morning, depending on where you are. This is Dr. David Nace, Chief Medical Officer at Innovacer, and I'm very pleased to have all of you come and join us for this webinar, Reimagining Healthcare, Optimizing Data and Analytics to Improve Health. So with no further ado, let's go ahead and get started with the webinar. So first, I'd like to introduce our panelists. We'll start off with Tim State. Tim is the Senior Vice President for Associate Health and Wellbeing at Humana, where he's responsible for some 50,000 associates and about 80,000 dependents in associates in total to ensure their health and well-being, which has been an interesting year. I would assume that has been the case, and welcome, Tim.
Great to be with you. And yes, interesting is an understatement. Thank you.
That's right. And we also have Beth Neubauer, who is a former president, group president, especially president at Humana, and prior to Humana, where she had a long career, worked closely with Tim, also at Highmark in Coventry. So long history of working in the health insurance space. And I think watching it now as former president, you would also attest that it's been interesting.
Absolutely.
Great
to see you.
Yeah. So with that, let's go ahead and get started. So, you know, it's been, as we said, an interesting year, and we've seen a number of things come up related to health and well-being. Let's start with you, Tim. What have been some of the major things that we've seen as a result of the COVID-19 pandemic?
Well, you know, in addition to just the disruption I think we all have seen and felt from an employer standpoint, the tremendous impact on emotional health. I think that is very, very clear, right? Depending upon the source, you know, upwards of 70% of American workers say that this is the most stressful time in their career. And we've certainly seen that play out. And I think it's brought forward where we have vulnerabilities in the workforce. And I think more importantly, where employers and the system can step in at a time of crisis like this to address those. So it's been very revealing and empowering in some ways for employers to just fully step into their role in supporting the health and the well-being of the workforce.
And Beth, I know in the time that you were at Humana, you know, you watched a strong movement around issues of talking about not just clinical issues, but some of these social, environmental, and economic issues. Watching now from more afar across the country, working with many different organizations, you know, how have you seen the pandemic play a role in changing consumer health behavior?
Absolutely tie into what Tim said. I think that we've seen a tremendous amount of changes. People are in great need of behavioral health services. I think we've all seen that. The behavioral health companies were all slammed, even the telebehavioral health companies, in trying to get to folks. And I do think that it has created a visual for us to see the gaps in care and the fact that we're not necessarily looking at people holistically when we look at their health, and that's a real opportunity.
So Tim, it'd be very interesting to hear your point of view. You know, there's been a lot of discussions about, you know, the different changing restrictions in different states. People think the pandemic's over, they think it's not real, then the restrictions come back on, we have a second, third wave, all that stuff. And in addition to that, many of us have been learning to work from home. And obviously that, you know, brings up a lot of behavioral issues. I was just on the phone earlier with a family saying they just moved to a condo a year ago, and 800 square feet was not what they were thinking of having 2 working parents and 3 children in 800 square feet. So share a little bit about what you've been seeing for your associates and their dependents.
Yeah, no. Well, we had our first case of COVID-19 as an enterprise March the 12th. And within 2 weeks of that time, over 90% of our workforce had gone home. And so what we've all, I think those of us who weren't already working from home have lived through is how do you compress all the learnings and the disruption to caregiving and everything else that others who've been working from home for years have adapted to, and compress all that into a short period of time. And I think that what we've seen on the one hand the isolation, the kind of difficulty in remaining connected from and amongst teams, and the challenges inherent to collaborating differently. On the flip side, I think that at least for us as an enterprise, we've also seen a tremendous opportunity to rally around shared purpose, new ways to support each other. I think like any crisis, it's given us both some very significant challenges, but also shown us where we had some inherent cultural strength. But along the way, I mean, many of the things that you're highlighting on the screen also became very apparent. It was very clear that as people were disrupting their caregiving situations, let's say for those with children, they were in need of time, just simple time to reset those arrangements. And in some cases, some additional financial support, because so many Americans, don't have, let's call it a $500 to $1,000 emergency fund to deal with unexpected shocks to the financial system. So we had to think about how to lean in around caregiving support, the time to reset caregiving support, and also to pay attention to those members of our own workforce who maybe had some shock needs because their spouse and partner perhaps lost their job, and there may have been needs around food and essentials in the household. And all of those factors we had to lean into and create new forms of relief and support for, recognizing that it was not only about their productivity, but also inherently their well-being.
Now, Beth, you've been involved with the telehealth movement in the country. The delivery of healthcare has changed also during this period of the pandemic.
For sure. Obviously, people are really leaning in. And what's really changed, David, is providers are now using telehealth. And before it was, consumers aren't really using it. Well, my doctor wasn't using it. Now my doctor is using it. And I think it's going to persist because I think people are really going to say to themselves, it's not just a convenience issue, but it's also a safety issue for me. And I want to lean into this moving forward as well. So it's been great for that aspect of the industry, and I think that it's going to continue to stick. And I think it'll continue to grow over time.
Yeah, no, I think that's absolutely right. In fact, I've had some back issues because of the pandemic and being sick, and I have a physical therapy appointment tomorrow in my home in telehealth. So it's been an interesting experience watching this progress. It's also nice to have toys in the house to do physical therapy with. This issue of mental health is a key one, though. I want to underscore. I did my background in both family medicine and psychiatry, and I never expected to see something like this pandemic create the issues it has. Tim, say a little bit more about what you've seen in the workplace and how you've thought about addressing them from the specific mental health problems that you've seen.
Well, one of the things that I'll probably talk some more about is how we look at mental and physical unhealthy days using the CDC's unhealthy days metric. But one of the things that we have seen over this period is a sharp rise in what we think of as mentally unhealthy days. So those number of days out of a month, let's say, where people feel that they've not been mentally healthy, more from a stress and anxiety perspective for the most part. But what we've seen is that both the access to mental health services by virtue of telepsych has seen a greater than 10x increase, which, knowing the long-standing access issues surrounding mental health, that's actually a breakthrough in terms of getting help to those who have needed it. But also upwards of 20,000 of our employees taking advantage of virtual resilience building experiences that we made available, which speaks to the need fundamentally. It's just been a pronounced need that has persisted. But knowing that, we track this month to month and understand how the population is doing through sentiment analysis and so forth, you could very much tie the surges in COVID-19 to the after effects from a stress and a mental health standpoint. So it's work that will continue, I think, to be in front of us as a priority for quite a while to come.
We've always talked about the shortage of mental health professionals. Say a little bit more about this resilience building. What have been some of the tactics that have worked?
I think one of the things that has been important there is to make sure that we're leveraging the power of the team, the intact relationships that exist as a system of support within a team, so that as we're leaning in and making resilience building available, Yes, there are individualized solutions there, but where possible, how can we bring a team through an experience virtually together so that they can then become a system of support for one another from a resilience standpoint? That relationship influence and that social support being so important, and frankly, our unique benefit of being the employer and seeing where those relationships are, those teams are, and energizing a team for that collective resilience. That has been a major a difference maker for us.
No, that makes a lot of sense, and that's a great effort to be made as an employer for your employees. Beth, you've worked a lot, particularly over the past year, thinking about both providers and payers and data, and what do you think are some of the opportunities to be able to use data other than the traditional EMR and claims data around this, the kind of efforts Tim described?
Well, I think it's really important to look at all the data that you have, especially from an employer perspective. And Tim has done this. Look at the 401k. How many individuals are taking loans out on their 401k? Not just one loan, but sometimes two or more loans, right? How might you find out, people that are, stopping things as well is really important, not just to look at what is going on, but what is stopping. Are you seeing people not showing up for work, right? Are you seeing more paid time off that people are taking? There are indicators like this that you can start to pull together because you have so much data on your employees to start to see some signals and say, wait a minute, we might have some folks that are really struggling here when you combine these different pieces of data. Looking at the FMLA requests, looking at requests for other types of leaves, disability. There's a wealth of information that you have, but the important thing is can you pull this together in a meaningful way that allows you to have insights into your population so then you can actually go create some actions and some solutions.
And Tim, Beth was sharing in the last time the three of us chatted about how you use data and analytics to hold your own senior management accountable for the health and well-being of their employees.
Yeah, I mean, one of the great things about senior leaders is they're not only very goal-oriented, but very accountability-oriented. And so one of the things that we've done is use data to not only set some long-range multi-year goals around the health and the well-being of the employee population, but also generate some unique ways to measure our progress and to lift that up both at an enterprise standpoint, and we'll talk about this, but also at a team level, at a leader level, so that leaders can understand in a very simple score-based way where they are, where their peers are, and where they can focus to improve. And so it becomes a really important accountability metric on par with other things like employee engagement and, of course, core business performance that's so important.
No, I think this is so important. And we've talked about this whole issue around the social, environmental, economic issues in healthcare, addressing the majority of outcomes. And we've talked about behavioral health being so separate and less recognized. And we've even talked in the industry about this issue of equity. Beth, you've now worked, during your career with three significant, payers, health in your career. And what do you think are some of the barriers? This is all survey for change, but taking this information, what do you see as the barriers to really addressing this?
I do think that data is one of the biggest challenges that I'll talk from the health plan perspective that they have, is because you don't necessarily have the information in a centralized repository to be able to take a look at, number one, and then number two, you don't necessarily have all the information that's available that would help you understand if there's somebody that has social determinants. But asking simple questions like, are you a caregiver, for example, something that would allow you in your employee engagement surveys to collect that information, then bring that in and take a look at it again, can help you understand where you might be having problems. But the biggest barrier, of course, is the data, getting the data from the various sources, and then being able to look at it in a meaningful way.
It's interesting on this survey that lack of payment structures and metrics came up number 1 and 2.
Yeah, it is, and getting, how do you, as a system, as a delivery system, how is value recognized by those that have a stake in the system so that this can be incorporated. The data, the assessment, and what to do about it can be incorporated into workflows and frankly, into the accountability system. Because the truth is, in a whole person view, turns out, there's a tremendous amount of value there, both in terms of health outcomes and the like. So, but not surprised perhaps to see that's up at the top.
This is so important, and I know we've talked a little bit about behavioral health. I want to circle back to that before we check in with our audience, but I often say behavioral health is two parts. There's the mental health conditions, mental health and substance abuse, and then there's the behavior of people, right? And that really relates closer to the social, environmental, and economic barriers they may have, or what's referred to as the social determinants of care. In behavioral health, there's not been a history of screening and diagnosing patients. As someone who trained in psychiatry as well as family medicine, I can tell you I was always dismayed by the fact that medical providers did a good job of measuring because they had lab tests and other things, but mental health providers have not. Do you think there's an opportunity going forward to start thinking about collecting information about behavioral health and then applying analytics to that data?
I'll start. I think there's going to be a revolution there. I think that it was already kind of bubbling, although there were more pressing issues around just simple access and the lack thereof. But I think that now, with COVID-19 and what is out there, there's going to be a revolution and a need there, and the need for integration. I mean, one of the benefits that we have at an employer level is we can control certain points of access, let's say like on-site or near-site health and well-being clinics, where we can deep integrate and embed behavioral health screening into the workflow and the model of care by design. But I think that the underpinning to that has to get back to data, as you shared there, and then being able to bring that forward, in a whole person view that then you can take action on.
And I think the other thing is, that second bullet there, enabling self-assessments, really being able to reach out to people in a way that they understand. Most people wouldn't say, gee, I'm depressed, right? They might say, I'm feeling a little edgy lately, or I'm feeling a little down, or maybe I'm feeling a little tired. The ability to give people access to go, online or talk to somebody virtually really now opens up a world to them where they haven't had access to those resources in the past. So you'll be able to get at people sooner and be able to bring them into the fold, when in the traditional system, the provider has 5 minutes to spend with somebody. And unless they're sitting there looking them in the eye the whole time, they're worried about what they need to document in the chart. So I think these new tools are an opportunity for folks to really be able to get access to care and identify that maybe they do have an issue that needs to be addressed.
Yeah, absolutely. Most folks have one of these, and it's easy to reach them 24/7. And if you do it in a thoughtful way, I agree. I think there's a tremendous way to collect this data. Let's take this opportunity to just check in with our audience and ask them how their organization is integrating this concept of whole person care into their health and well-being strategy for the enterprise. So please, audience, just go in and use your chat box and pick one or more of the following. Is your current strategy for your associates, for your employees and their families, focusing on improving physical health? Is it more comprehensive? Is it focusing on a broad variety of not just physical and mental, but also financial health? There's an issue we didn't talk much about. Or do you currently don't have a well-being strategy? So while we're waiting for that poll, let's talk about this issue of financial health. Have either of you thought about that as a metric or a concept?
I'll let Tim go first. He spent a lot of time on this.
Yeah, one of the 4 dimensions of well-being, the way we define it, is in the area of security, and core to that is this concept of financial health. So we actually see this as being fundamental. It's something that we have a number of different metrics for, both in terms of how people are feeling about their financial security, but then also what they're doing about it. So we can bring forward data and information around, are they taking advantage of the financial education opportunities? Are they contributing to their 401k or their health savings accounts? What's happening, in their lives? And then use that data to segment the population and understand where we have great areas of unmet need, but also leverage, again, back to the social influence and the leader component, leverage the teams and the leaders to amplify where some of those opportunities are, and also help us shape strategy where we know that we need to lean in and take some concerted action more from an enterprise standpoint, maybe in how we design a benefit, or in times of crisis, maybe how we make special relief available. So it is integral, and I doubt I have to share with this group on the call the interrelatedness between financial insecurity or and many of the other issues that go along. So yeah, it has to be front and center in the model.
Absolutely. Well, let's go ahead and check in see what the answer was from our audience and look at the poll results. Interesting. Beth, what do you think?
I'm surprised on that we have 38% on focusing on physical, mental, and financial health. I think that's really positive and a little bit higher than what I would have thought, but clearly there still is opportunity for improvement.
Tim, your thoughts, your reaction here? Yeah, my thought, like Beth's, is that that's higher than, let's say, 18 months ago. Had we taken this poll, what I suspect is the blue bar would have been markedly smaller. And again, back to what has the COVID-19 experience and really 2020 in general brought forward, and how organizations are now responding to some of these acute needs.
And we need to figure out a way to get those 19% to zero. That's for sure. Let's do a little bit of a deeper dive. You've both spent time in Humana, and Tim, you're leading the efforts there around well-being. Let's go into a little bit more about Humana's journey. Tell us a little bit about the journey.
Sure. Well, we think about this from an inside-out perspective, and what I mean there is, I think no matter what a company is focused on in terms of their mission and their business model, taking a whole person view and setting goals around improving the health and the well-being of their population, it's smart business for a variety of reasons. In our case, being that our purpose is around people's health and their well-being from a business standpoint, it really creates a lot of synergy. So that the way we think about the members that we serve is also the way that we would want to have our associates experience us. And quite frankly, when members and patients work with our associates, our teammates, the experience that they will have is with a living, breathing person who actually believes that the company is there and committed in this way. And so with that in mind, we've set a number of long-range goals around how we can leverage all of our capabilities to improve the health and well-being of associates and also the members we serve. And of course, our values and how we live those out and hold ourselves accountable is a really important part of all of that. I will talk about the associate outcomes and so forth, but you see here referenced. We've also brought that same concept to life in a number of the different markets that we serve. So this idea of a bold goal around improving health has led to how we think about improving the social determinants of health in the member areas where we have real influence. And we're proud of the ground taken there, though there's much further to go. And I think what we've accomplished in the market environment with all those complexities is a reflection of what we're working really hard to accomplish internally, and have been on a beat now for greater than 6, 7, 8 years with a real commitment that works at the board level down to improving the health and the well-being of our employee population.
No, that's an incredible commitment. And Beth, you had shared with me in the past this issue of the bold goal. And having been in now, you spent your career in 3 different insurers over time. Tell us about the history when you were there about this idea of the bold goal. Why was it so bold?
Well, it was our North Star, and the challenge was, how do we make not just our associate population, but our entire population, the communities that we serve, 20% healthier by 2020. And we wanted to look at improvement in healthy days. And so what that meant was you couldn't just look at physical health. You had to look at emotional health. You had to look at all the social determinants. And it was just a very galvanizing bold that really led people in the organization to think very, very differently. And, you know, kudos to Tim, because quite frankly, he had been doing some of this work well before we started it. But it's absolutely on the right track. You see other health plans and other organizations now focused in this area as well. But until you get to the root cause, which is often broader than the physical cause of health, you'll never be able to address the physical.
Well, we're all waiting patiently, Tim. Did you make the goal?
We did. We did. As an employee population, we reached 20% improvement. Actually announced it in 2019, so we got there a year early,
Wow.
which we're really pleased about. And what that was about, excuse me, was a 20% improvement in those healthy days. Back to that CDC metric, which is a long-standing population health metric, asking about the number of physical and mental unhealthy days in the last 30 days. And so more of a whole person view. Now that was even kind of a less complete whole person view than what we use in the rest of the work, but it was a simple way to start to introduce this idea of physical and mental. And it amounted basically to 2.3 million more healthy days cumulatively over the period of time that we pursued the bold goal. So that's about a week more of healthy days at a person level, average per year. So that, I don't know how you put a value on that, but you know, a week of better health in the course of a year, I think, you know, most of us would sign up for that.
No, so this is fascinating. And you know what's very interesting, this part of the conversation, Tim, you know, you're responsible for the health and well-being of your associates and their family members. But also Humana has members, right, which they provide health insurance coverage for. And the bold goal has been used, it sounds like, in both camps. Is that right?
Exactly. Yeah. So now in well over a dozen different markets, leaning in at a community level to say, how can we work with community partners, from providers to social services, transportation companies, food banks, etc., to understand and galvanize around the core needs in that particular population, so that we can identify and deal with the social determinants of health there that are specific to that community. And you know, oftentimes it's not that the community resources don't exist. It's how do you make it easier for people to access it, and how do you use data to help to identify where and how to mobilize. So what we've accomplished internally in a way unique to an employer also works, you know, in principle in the communities in which we serve. And again, early on that path, but we've been able to move the needle in a positive way in you know, a range of different communities based upon that, and push some of those social determinant assessments and actions into workflows with partner organizations, and just get mobilized and accountable around the same types of outcomes here.
Beth, it sounds like there's a very unique culture at Humana.
Very unique culture and great partnership between the businesses and the human resources department. What Tim shared with us as leaders was really an eye-opener for most of us. And I think that if you think about it from a leadership standpoint, you want to make sure that your employees, associates are bringing their A game to work every day. And it pains you when you understand that maybe we're not really addressing all the needs. So the culture was, we're all in on this, and very supportive with what was started in Tim's area.
Fantastic. I think for both of you, it's a tribute to your leadership as well as the rest of the team at Humana. Tim, I'm really interested in this concept of lifelong well-being. Walk us through a little bit about how you think about it.
You know, one of the early challenges was, you know, our ambition was greater than merely physical health, as we've talked about, and how do you bring a science-based view of what well-being really means? And so what you see here are the idea of these four dimensions. What does the science tell us about what we all have in common as humans? What works together within us to generate what we as people would consider well-being, and also then what leads to the key outcomes we care about. And so early on, we oriented around this model of these four dimensions that not only needed to be interrelated and provable from a science standpoint, but also measurable. And so then, of course, that led us to think about, well, how would we measure this at a whole person level, both for individuals and also at an enterprise level? And so we created assessments an individualized assessment in partnership with the University of Michigan, so that at a person level, there was a well-being index, if you will. People could see their enablers and barriers and how they relate to the rest of the population. But then, as Beth was alluding to, also created a snapshot for leaders, so that any leader of 200 or more associates sees how they're doing in a score-based way in each of those 4 dimensions, which comes together into a common score for them based on over 70 different metrics that feed in. So if we're talking about something like health, we can have information in there about average biometric risks, or how their associates might be engaging in different, wellness programs. If it's something like belonging, are they engaging with network resource groups? How do people say they feel about the strength of their relationships with their coworkers and leaders? Security, we talked about, with financial engagement and 401k, and purpose, volunteerism as an example, or their career development. So the truth is, as an employer, we deeply influence all of these dimensions. But how do you translate that influence into something that a leader can see and understand, and how do you create a common vernacular in the enterprise around these, so that it normalizes the conversation about things like emotional health that could sometimes carry a stigma, right? And may be unfamiliar to a working kind of exchange. And so that has been the measurement, the data-driven component of this has been very big. But I would also say that from a social standpoint, frankly, the currency of stories has been huge. So you think about, how personal this kind of a journey is. It's been so instrumental to be able to share as associates come forward and relay their health and well-being journey. How do you share all of those stories as a common form of currency? And that's been very, very powerful as we move forward. And at the end of the day, it does, of course, generate business outcomes, as we'll probably talk about, and help the company be stronger as well in a number of different facets. But the human impact is really the thing that we're probably the most proud of.
Beth, this framework around thinking about well-being is a leap ahead of where folks historically have thought about healthcare services, isn't it?
It is, but given what the pandemic has done to accelerate various areas of our lives, whether it's technology, this is an area where employers, providers, health plans, you name it, really have to think differently, and they have to think holistically about an individual, and to have access to the data is going to be really key.
That makes a lot of sense, and I'm excited to hear this. And I also understand, Tim, the challenges in trying to measure the return on investment for a client as a health insurer around this area.
Right, exactly. And what's interesting is we've seen that just in working with colleagues across industry and so forth. I think that the modus operandi there was already starting to shift a little bit pre-COVID, but especially in the world of COVID. The challenges around these 4 dimensions, as an example, have been so pronounced that it's less of an ROI conversation a lot of times, as it is just culturally and from a value standpoint. More and more companies absolutely get it. I mean, this is one of the top issues that has kind of, engrossed their C-suite over the last 12, 18 months. How can we be a sustainable organization? How can we keep a committed workforce that's productive and engaged? One of the leading sources, actually the top driver of employee engagement over the last half a dozen years at Humana has actually been the way people answer one question, which is Humana committed to my well-being? So I'm paraphrasing, but sense of commitment to and from about such an integral part of people's lives, it engenders a certain degree of goodwill, engagement, and commitment that right now, given as much disruption as we've seen, is incredibly valuable. Again, how do you put a dollar on that? We could debate it, but the inherent value seems to be very clear. Question is getting there, and every organization is a little bit of different spot.
No, it's a great vision that you're implementing. I still remember as a young physician in training reading a book called The Healthy Company, and I remember thinking it was way ahead of its time. I think it was. So it's good that we're starting to think in this way and asking questions like that to your employee base. So let's check into this issue about this return on investment. You have services you provide. Humana is one of the largest Medicare Advantage providers in the country, and you've done this bold goal. And give us an update on the progress you're making.
Yeah, well, the progress has been very, very encouraging. It also speaks to the complexity of the issue from an external standpoint in the marketplace. I think that what we've seen is in the markets, in the BOGO communities where we've been at it the longest. So you take a community, say for instance, like San Antonio, Texas, we've seen roughly a 10% improvement. You know, it just runs up to COVID. We don't have the refresh numbers, but a 10% improvement in healthy days in that community of our members, which is wonderful. We have other communities where the progress has been more limited, and in some cases gone the other direction, again, because of complexities in those communities. I think the theory of the case that says if you take a whole person view, you go with specific data-driven insights about that community and work with partners, engaged, partners in that community, can you affect positive change? The theory of that case has definitely been proven out in these markets, and that's what's exciting. And remember, from a return standpoint, we know that the relative value, let's say, of an additional healthy day in our membership, it correlates to a little over $15 per member per month in value if you pull it all the way through. Which again, do we really need that in order to understand the human impact? Maybe not, but there's tremendous value to unlock when we really take a whole person view, when we think about all the different resources. Again, whether it be transportation, where roughly 9 million seniors rely on others for their transportation. We think about food insecurity and how that interrelates with conditions like diabetes and cardiovascular health, or we think about social isolation and loneliness, where we know that the strong correlation there with conditions like Alzheimer's, et cetera. So there's a tremendous amount of value. We've seen the model play out, and it's just a function of time and maturity, based on the communities that we serve.
Yeah, it's really exciting, and I'm starting to see some questions come in on the chat box. So a quick reminder to everybody: please put some questions in here into your chat box, and we'll make sure we tee them up for our two panelists. It's very interesting about. These are tough communities, these bold goal communities. Louisiana, Texas, these are Tampa, you live in Florida. I mean, these are tough communities.
Absolutely, and those are the communities that you really want to go after because you're going to see a difference pretty quickly, but it's a meaningful difference in those communities. So we weren't afraid to go big.
Yes, this is not low-hanging fruit. You're diving right into it in these communities. It's quite impressive. Let's take this opportunity to actually just go back to this issue around improving people's well-being and purpose-driven focus. Tim, maybe you can give us a summary of what you've done at Humana in that regard.
Yeah, so in addition to mobilizing leaders and teams around the issue, setting them up in a data-driven way so that they can take action, plan actions themselves as an organization, and take ground and know where to hunt, so to speak, what they can promote. What we've seen, and I think we've got a few data points here on the screen, but over time, the collective impact of that can be pretty extraordinary. I won't read a number of the stats here on the screen, but big challenges that face large companies, really any companies, can be addressed. Particularly that issue around lifestyle-driven health and the biometric risk improvement that is shown here on the slide. Think about the fact that generally we spend 8, 10, 12 hours in some way connected with each other at work. And from a lifestyle health and a habit formation standpoint, the ability that we have there to influence. When we combine the data components, though, it also means that now if it's reaching out to an individual to connect them to, let's say, a diabetes prevention program, for someone who may have prediabetes based on data that we have, corresponding with financial well-being data that says they're going to be more successful if we also come together with a financial well-being solution. There's tremendous power and impact to that ultimately translates into things that most organizations care about. A more resilient workforce, greater productivity, fewer unhealthy days, and higher engagement, as we talked about. And we find that it's generally not a shortage of programs and policies that exist. It's really about not bringing things forward in a data-driven way and not creating experiences that can sometimes be the barrier. People are moved by experiences and social influence, and that's the reason that the population assessments and information are so helpful in moving the needle long term here. And that's underpinned by analytics, of course, that help leaders and teammates know where to start.
Yeah, Beth, I'd be really interested in your perspective around this concept of leveraging data, digital technology, and analytics in improving health.
I think it's absolutely critical. As an example, I would bet most people don't know how many of their associates within their organization that are maybe at lower or more moderate incomes have or have not taken a budgeting class, as an example, or how many have multiple loans out on the 401k. When you as a leader can get access to that data, then you can start to champion some of the solutions that you have in an organization to be able to bring to the table. But if you don't have the data, you can't do that. And then I'll also tell you that once you get some of that data, as we did, then you want more. And then you ask and say, well, what about this data that we can collect? And I'll also just give one other little shout out to Tim and what he and his team have done. Many organizations collect health assessments and then they do nothing with the data, nothing. We were able to put in social determinants into our wellness assessment after a couple of years ago. After talking to Tim and others, I started to really understand that. So we put it into our wellness assessment and we collect that data now. And a lot of people don't seem to understand. They think social determinants is Medicaid and Medicare. There are a lot of working individuals that have true needs around social determinants. So again, you've got to really be able to collect the data, but once you share that, you will be able to get your leadership team on board, and then they will become champions with you to help you drive solutions to the employees.
That's great. Well, let's check back in with our audience and take another poll here and ask them around this very important issue around the social, environmental, and economic determinants of health. Which of the social determinants of health does your organization capture? So please go into the chat box and answer this poll, and we can select one or more of the following economic factors like education, employment, income, social factors like family, community engagement, physical factors like housing, travel, safety in the community, behavioral factors like stress, anxiety, depression, or your organization is currently not integrating those social determinants. So while we're taking that poll, I'm really looking forward to the results. A couple questions have come up, Tim, on the chat box. Here's one. Did you have to educate your employees to make them more comfortable about collecting these new forms of data?
Yeah, we absolutely, and that's an education that never ends. But we approach that from a couple different standpoints. One is that we over-index in educating leaders because, as we all know, leaders are so important to reinforcing and clarifying and being there to help make sense of things. But we also needed a grassroots network of folks there at the local level who could step forward from within teams to help to educate, clarify, reinforce, and so forth. And so we have a network of over 1,000 champions and advocates, as we call them, but they're well-being champions and advocates who have day jobs, but in addition to their day job, they're passionate about this topic. They want to be part of the solution. They want to help. And so we enable them to do that. We guide them. We give them, some information and ways to take that forward and just continue that social movement inside the company. So working it really from both ends, at the front line through grassroots efforts, broad communication, et cetera, and engaging leaders in a continual way so they can be conversant in this.
I like this idea of starting with the leaders so that they can start to take on these values and be able to answer the questions before you then roll it out to the rest. Another question, which is very pertinent to this, is what differences have you seen in your approach and or the impact between taking this new path toward your employees versus your insured populations? Are they different?
Yeah, they are so different. And I mean, and they're similar from the standpoint, look, we all have those common needs that I articulated because we're people. And so those different aspects of our well-being are just going to be universal. However, I think the differences are we have tremendous influence with our own associates because of the time and engagement that we have there. We don't have as much direct influence at times with members, although if if we're in a care relationship with those members, let's say a telephonic care manager nurse with a member, the relationship and the bond as an individual can be extraordinary. I mean, many of our nurses, they're the first phone call that a member makes if that member is going to travel out of town, even before their own family member sometimes. So it depends, but the reach and the influence that you have with associates and by extension their families is pretty extraordinary. And I think that the other thing is that again, we serve many of our members. We're so privileged to serve are of Medicare age, 65 and over. So you do run into you encounter some different types of challenges there that are just inherent. But I think the reach and influence with associates is probably one of the contrasting points. However, tremendous things are possible with the member. Usually, it's about a one-to-one relationship. Again, with a care manager or another member of the Humana team.
No, that makes sense. Well, let's go ahead and take a look and see what of these social determinants of health elements our audience is collecting. We can bring the poll results up. Well, it's all over the place. Beth, what do you think?
Yeah, my first reaction is economic factors surprised me a little bit. Then I thought, no, we have employment and income information, and we probably have, when we have the education information, that's all in your HR system. So that's good. And it doesn't surprise me the physical factors, including housing, travel, and safety, are not quite up there. But overall, I think that it's really good. The numbers that people are demonstrating on the top 4 rows that they're starting to collect it. So that's, I think, real progress from just a few years ago.
Tim, I bet you these numbers would not have been the same prior to the pandemic.
I would agree.
Yeah, absolutely. And it's interesting because financial issues you see there at the top of the list. Now, financial issues have been the leading source of quote unquote stress in the U.S. workforce for a number of years. Again, this experience we've all been through over the last year plus has really brought that forward, and so it's not surprising to see that topping the list.
Well, it really is eye-opening, and it's been a very interesting year. And one of the most important things we've talked about, we wouldn't have any of this information if we weren't able to collect data. Beth, you and I talked a lot over time, and you've learned a lot about what we're doing here at Innovacer around data. And you experienced this working with Tim around as a leader at Humana, and Tim's expectations of taking a look at data. What's the key here to making data-driven decision-making around healthcare?
Well, you have to have access to the data, and kudos to Tim, because it wasn't easy for him to get access to all this data, because you're working as any organization, you're working with multiple vendors, and they all have different data formats, and sometimes you can't even get at the data based upon the way legacy systems operate. So I think the key is really ensuring that you can get in the data, but then you have to be able to bring it into a platform that allows you to analyze the data and push up insights, if you will. So there are a lot of moving parts there, and that's why I just think it's, in this day and age, with what the wonders of technology, now we can get at the data, right? Now we can actually put it on a platform that makes it easy for the non-tech person to be able to use, the business person to be able to use. So I really think that's the key, and that's probably been the biggest change over the last several years. There are companies like an Innovacer, as an example, that can actually come in and do this for you, and it just opens up a world of opportunity as to what you can do either for your patients, your members, or your employees.
And Tim, I can't imagine that without having analytics that give you actionable insights, that you would not have your leaders be able to be as engaged with driving results as they have been.
Yes, absolutely. In the early days, It was about the role that that data and those analytics could play in creating a case, a case for change and engagement around this. And then as time went on, it was about, okay, we believe now, what actions do we take? Well, how can we build predictive, models and so forth and understand what's going to affect the greatest change? And also, what will support our ongoing learning? Because this is, the path that a company takes around this is going to be somewhat unique to that company. And there's a lot of learning that has to happen, along the way. And so how do you capture all those insights? How do you segment the population so that you can really target specific resources or, interventions to the needs where they exist? I think that's one of the great and interesting facets even of this last year plus, is that understanding the workforce in a different way, but through segmentation, those who are working virtually, those who have some of these unmet needs we've talked about today, and then understanding that, a one-size-fits-all strategy was never going to be successful, but especially now, the need for that data-driven insight that's segmented and understands where people's needs are is so powerful. So yeah, it's been an ever-present component, I think, for us, and it'll continue to be.
David, I just want to add one more thing. Healthcare seems to be the last industry and the only industry that doesn't have that holistic view. I mean, if you're building a car, you know where every part of that car is coming from, right? You know where it is in terms of inventory. You know exactly where it gets put into what slot on the assembly line. But when we're talking about people's holistic health, it's physicals in one silo, behaviorals in another silo, and social determinants are in many, many different silos. And like any other industry, if you truly want to get the full picture and you truly want to optimize somebody's health, you've got to be able to get that data. You've got to be able to bring it in a systematic way and be able to use that then to provide solutions. So it's time we step up in healthcare.
Yeah, you beat me to the punch. Healthcare is the last industry to be digitalized, and we're starting to think that despite the fact that most enterprises, and Tim, I would imagine you still even experience this, Humana being a leading edge, you've got on-site data warehouses and tools, and most of the other industries have moved to the cloud. And then there's always that long-standing issue that the provider has information that you don't have as a payer, and the patient has information that often they share or don't share with the provider. And then as a payer, you have information from a broader view of all of the things that the employee, if they leverage their health benefits, or your members are accessing. So everybody's got a different piece of the elephant, but they're still housing the information in their silos. And Tim, I would imagine that there's a great future given all that you've learned at Humana in terms of moving to the cloud. And I think you're starting to do that very rapidly. Is that right?
Very much so. A big emphasis and investment of energy there. Knowing that we believe we can play a unique role. To your point, there's so much value bringing the pieces together, creating value along the value stream. So you think providers and the partners, and of course the member. How do you render information that's actionable at the individual level, and then also bring and connect that information with providers and the rest of the ecosystem. So no, you're exactly right, and that's a revolution. I mean, back to your point, Beth, that revolution is now upon us. In some ways, the fact that we have the cloud technology, the fact that we are where we are now in terms of what can be done, it's a great time. Though the industry may be a little late to this, it's a great time to absolutely get it done now. And we're deeply committed to that. We've seen the power it can have, both for those we serve and the long-term strategy.
Beth, you've seen some of our clients in the work you've done helping us think through things here at Innovacer, start to analyze data faster and start moving to the cloud. How quickly do you think the pandemic may have accelerated this?
Well, for sure, it accelerated it, but now it's become a table stakes, David. If you're an organization and you're not leveraging data and you're not leveraging data very quickly, very, very soon you're going to lose your competitive advantage. So data analytics is just a key priority for most top executives these days.
Well, we've been very pleased to have Humana as a client. We've been working with one of the major programs in the Medicare Advantage to help with STARS, getting clinical data from the providers network, information they have that Humana doesn't have, and put insights from that broader view back into the workflow of the provider. It's a work in progress, and we're doing that across the country. And here's a little bit about our point of view. Beth, I know you've worked with us hard around this. How do you really bring data from all these different silos? The pharmacy has data that other folks don't. We've talked about the community-based agencies. They have data. The health systems. How do you bring all that information together and then really harmonize it and then activate that data in a private and secure way? And we know now that the cloud is even more secure than on-site because people are always hacking these on-site systems, and really get to the point in healthcare where Amazon has been in retail, wholesale, supply chain manufacture, where everybody has their own view. We all know the consumer view, and yet it's private and secure, and the system begins to learn about you and make everybody smarter. Well, the way we like to phrase this is having everybody work as one or care as one for the population that they're serving, and being able to start leveraging these data and analytics. So this has been a great discussion. I have one last question for Tim. One of the questions that came in from the audience: what is the future of the bold goal for Humana, and how can providers start to work on similar strategies?
That's a great question. Well, the bold goal concept continues, very strongly in terms of the communities in which we serve. So this idea of improving health over time, this idea of focusing on social determinants of health, but in a community-specific way, that very, very much continues. By the way, on that topic of bold goal for us, if you go to populationhealth.humana.com, you can see our most recent progress report there in terms of the external bold goal work. I would say that in the provider integration, I think the part of the question was how to get providers into the mix. What you'll see is that in these various communities, many examples of where bringing that social determinants data, bringing screenings into the workflow as an example at the provider level is having an impact. And we very much believe, of course, in the value-based model of healthcare. And so there is inherent value in understanding these needs. So you'll see some examples brought to life in a way I don't have time for, of course, here. I would say on the associate side very quickly, we continue the bold goal work there. Having met the first generation bold goal, we've committed ourselves to another expression of the bold goal, improving overall well-being and improving healthy days. Clearly, a global pandemic threw an interesting wrench into that a little bit in 2020, but actually has been a source of tremendous resilience and pride in how we've been able to respond to that. So yeah, very much continues, and it's part of how we think about our future and human care in general.
Great work you're doing at Humana. Very proud of you, and Beth, I'm sure your contributions there really working with Tim really led to this great improvements in health and well-being you've made for your associates and for your members. This has been a great discussion. Let me just ask each of you, do you have any last comments or recommendations for the audience? Beth, let's start with you.
Sure. My only comment would be reinforce that data and analytics are a competitive advantage that people need to double down on, and it just should be a priority that everyone on this webinar should really be thinking about. And if their leaders aren't thinking about it, they should become a champion.
Awesome. Tim, final comments?
I think two things. One, this idea of goal setting, setting a goal around the improvement, a whole person improvement within your organization or the group that you serve, I think is a powerful way to galvanize and inspire. And then the other thing is that as a competitive employer play, more than ever, job candidates, talent, and so forth are going to be looking for organizations that will prioritize and focus on their well-being. There's no question about that after what we've been through. So a strong encouragement to think about that and take it on.
Great. Well, thank you both very much for participating in this webinar. It's been very insightful and a joy to actually hear about the progress that you're making at Humana and the work that you've done there for both of you. And thank you to the audience for coming and participating. We will follow up with you, provide a copy of the slide deck so that you have a ability to go back and review that, and also some information on some of the work that we're doing here at the award-winning company Innovacer. Again, thank you very much. And with that, this concludes the webinar.